Hello family. So in keeping with our Breast Cancer Awareness Month theme and series for this month, today I wanted to talk to you about screening. If you haven't checked out the first video, just giving a broad overview of what exactly breast cancer is and answering a few questions about that, go check out the first video. So the recommended screening modality for breast in general for screening for cancer is mammogram. Mammograms are still the gold standard for screening. Now, there is some variation in the recommendation on age of when to start screening. For example, the American Academy of Family Medicine, Family Practice, the American College of Obstetrics and Gynecology, the U.S. Preventive Task Force, the American Cancer Society, all have a few differences on the age that they suggest recommending starting screening at. And it varies from 40 to 50. There is a wide variety. The best recommendation that I can give you is talk with your physician. Your doctor can talk with you and weigh in your risk factors, your individual health and situation to give you recommendations on the appropriate age to start screening. Also, there are some variations in recommendations on the interval of screening, whether to screen every year or every other year. Again, this can be individualized with your primary care physician. So I highly recommend speaking with him or her, either your primary care physician or your OBGYN, on the recommendations for screening for you individually. But it is highly recommended to have screening either annually or every other year at the latest. Then the question comes in about, what about MRI? Currently, MRIs are still not recommended for routine screening. We do use MRIs for screening for monitoring. We will use MRIs in high-risk patients, maybe with positive genetic testing, or just the higher risk for breast cancer. Now, we'll use the MRI alternating every 6 months between mammogram, 6 months later MRI, and back and forth in that interval. But it is not recommended currently for MRI alone. Currently, there are no guidelines for men for breast cancer screening. And as I mentioned in my last video, men definitely can get breast cancer. Again, this is another discussion to have with your primary care physician. And also, this is a discussion to have with family. It's really important to know family history and fill in any gaps of information about past family history or genetic testing. If you're unsure about family history of cancer and such, there are genetic counselors that can talk to you and draw out your family history and make recommendations to you on whether you should pursue either advanced or early screening, or if you should pursue genetic testing yourself or your children, etc. Ultrasound. So ultrasound is not a recommended for annual screening. However, we will use ultrasound in the case of a questionable mammogram or in a person, especially with dense breast tissue, that maybe the mammogram couldn't pick up something specific. Ultrasound is very good at delineating any masses or things that we may see on mammogram, so further investigation. But we don't use ultrasound for routine screening, but they are a helpful tool to use for further evaluation. Now, don't want to leave out my trans community. It's very important, again, to speak with your primary care doctor or whoever is prescribing you hormone therapy to, again, discuss those risks of any prior family history, etc., as you add the excess hormones. So it's really important to have your hormone therapy monitored properly and to get it in confidence with your doctor, and so that they know your entire health history as well. So I hope this was helpful, and more importantly, as we're coming up on the end of the year, and if you haven't gotten in that physical with your doctor, please get that physical in, have those discussions about any past family history or personal history, health history, and get those recommended screenings when it's time. Stay healthy, family. Bye.